Talofa and welcome to the Salmon Scientist podcast. I'm Amy, the Salmon Scientist, and let's get into today's episode.
I'm Fijian, yeah. So I'm Taina and I'm Fijian. So I came from Fiji just to do this PhD and hopefully finish soon and go back home and do work and help, with the surveillance of infectious diseases back home. So
Can you show us what you're doing today?
So I've incubated my viruses just to help convert them to DNA. So it's a conversion from RNA to DNA. And they're incubating there for a few minutes, reverse transcriptase, PCR. And then I'm just setting up my tubes so that after that I will be able to know if I actually have DNA or not. So this is just the beginning.
And for your project, could you just describe the importance of this process for your project?
Okay, so at this point I'm still trying to optimize my protocol so that I'll be able to test my samples that are still frozen. So I have about 1,800 samples to test, respiratory samples.
And then those are from Fiji?
From Fiji, yes. So these are samples that were collected before COVID. So it's it will enable us to see what viruses were circulating in Fiji before COVID hit. So I'm trying to optimize my protocol so that I'll be able to make a protocol that's cheap enough that we'll be able to implement back home if there's a need to, especially when testing a large amount of samples.
So for instance, if someone comes into the doctors in Fiji, then they could test the different respiratory samples back in the clinic, at the lab in Fiji, and by using your protocol. Is that the idea?
Yes, that's the idea, Because at the moment we are only testing a few viruses. So I'd like to, this protocol expands that the number of the panel of viruses to more,
I think it's really important, I guess, to understand people's health in terms of what they're infected with, and then giving them appropriate, help and medication with that.
Yes, for management of patients, that's correct. So that it allows us the physicians to manage patients better if we know what other viruses are circulating.
I hope you're enjoying the podcast so far, and if you are, it would mean a lot to me if you could follow the Salmon Scientist podcast. It helps me to keep this going and bring you more episodes. So hit follow and let's get back to the episode. And is there anything else that you wanted to share, I guess, with community in terms of different influenzas, being aware of them or how to?
So during the cold season, especially during winter and back home in Fiji when it's cold, there are lots of people who get sick, the cold, but it's not only influenza. There are other viruses that can cause those respiratory symptoms. So for babies and the older people, older than me, their immune system is not as strong as younger people like you.
Right.
So getting to know what virus affects them will help doctors manage them better. So we're all Pacific Islanders, and as soon as we go to the hospital, we prescribe antibiotics. But then viruses are not treated with antibiotics. So hopefully we'll be able to treat patients better when we know what is affecting them.
And then how did you get into research here at the University of Otago?
Yeah, that's a good question. So I did my postgraduate at the University of Sydney, and then it took me quite a while to get here. So I was looking only in Australia, but it's for us back home in the Pacific Islands, it's quite hard to get a scholarship to sponsor us. So universities were accepting me, but there were no financial support. It's the money. It's expensive. And Saki was here before me, So he opened that door for me,
Wow.
and he told me that there are scholarships available for Pacific Islanders, for indigenous people. So yeah, so I got that scholarship, and I'm just so grateful that I had that opportunity. And I'd like to encourage anyone who's interested in doing research. You pursue your dream, and you never know, it will have a lot of effect on your people, on the people that we serve. Yeah.
I think even your work is going to have a massive impact for communities in Fiji, and also just thinking about your journey here, really congratulations to being on this path, because it is very hard. Being New Zealand born Samoan is hard, but coming from the islands, it's even harder.
Yeah, I think being older has helped me to adapt faster, and I'm just enjoying my time here. Like I've told a lot of people that I love the weather here. It's so nice. I love winter, and they say, "Oh my goodness, you're the first one." I mean, there's hardly anyone who says that I love winter. So I'm enjoying my time here before I go back home to the sun and the sand and the beach. Yeah. So I think being older has helped me to appreciate the season I'm at.
Yes.
And the friends I've made, and like I only have less than a year to finish, and I'm already telling my friends I'm going to miss Dunedin and the people that I've met here. Yeah,
That's beautiful. Sounds like a really empowering time, and that freedom and kind of really knowing yourself and being really staunch in your values and who you are, and just really driving the rest of your research.
Yes. Yeah. And I think I'm thankful for the community, the Pacific Island community and the Fijian community here, and the church that I go to, my church family. They've really helped me to be comfortable here. And so I miss home, but miss my family, but I'm happy here.
That's amazing.
Happy to be here, yes.
Is there anything else that you wanted to add or to share with people?
Everything that we do, no matter if our motives are right, there'll always be a small percentage of people that will have a negative thought about the good things that we do, but don't let those little percentage of people deter you from achieving what you feel is right.